Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we are honored with great guests with me, Mr. Richard Capriola from Houston, Texas. Let's welcome him. How are you, sir?
I'm doing just great, Dr. Moby. Thank you so much for inviting me to spend some time with you to talk about this subject of adolescent substance abuse.
And that is such an important topic, and we're gonna go start into it. So tell me first, how did you start about into behavioral health and all these addiction talks?
Well, I have a long history of, first of all, working in education
Mm-hmm.
as an administrator
Mm-hmm.
for about 30 some years. And towards the end of that time, I started working at a mental health crisis center. And I noticed that many people who were coming to the crisis center had not only a mental health issue, but a substance abuse issue. So I
Mm-hmm.
went back to school and got a master's degree in addictions counseling, continued to work at the crisis center for a while until I was offered a position at Menninger Clinic in Houston, Texas. Menninger Clinic is a large psychiatric hospital,
Mm-hmm.
and I worked there for over a decade treating both adults and adolescents who have both mental health and substance abuse issues. When I retired a little over a year ago, I wanted to write this resource for parents so that they would have a resource that would help them to better understand adolescent substance abuse. I wanted it to be non-technical. I wanted it to be something that they could read fairly quickly and walk away and think, okay, I've got this. I understand this issue better, and I'm more prepared now than what I was before.
Mhm. And that is such an important topic. It is sad on many aspects, yet, are basically teenagers, which actually will predict our future of the country. And they have these problems which we cannot seem to be have good control right now, and which is sad because for many level, like I said, future of our country is in it will be in their hands, and then what are we going to teach them, or so that is very important. So tell me a little bit about the scope of this problem. Is it pretty bad in Texas only or everywhere?
It's throughout the country, and the drugs and the substances that teenagers are using still continue to be alcohol and marijuana.
Mhm.
There is some use, less than 5% of the more hardcore drugs like cocaine, LSD. There is some abuse of prescription medications like Adderall and Ritalin, but those tend to be, 4% of seniors or less.
Mhm.
The drugs that the substances that teenagers still are gravitating to continue to be alcohol and marijuana. But what we have noticed is in the last 3 years, there
Mhm.
has been a tremendous increase in what's called vaping of substances,
Mhm.
where
Yeah.
they will take a substance like nicotine or marijuana and they will use an instrument to turn it into a vapor. The number of kids who are turning to vaping in the last 3 years has increasing at a dramatic rate.
Mhm. And so I will also like to know, what do you think is the most important cause or some of the important causes of substance abuse, especially in teenagers?
I think for many teenagers, it gets back to a mental health issue. It
Mhm.
gets back to an issue like anxiety or depression or some type of trauma in some cases,
Mhm.
where these youngsters are using a substance like alcohol or marijuana to
Mhm.
medicate an underlying mental health issue. I think that happens in a lot of cases.
So that is more. So is it that the depression is undiagnosed, and second is or inadequately treated?
It's in a lot of cases it's undiagnosed. It's
Mhm.
there, and many times it's the substance abuse, the alcohol, the marijuana, the drugs are masking it.
Mhm.
so that many parents don't even realize that there's an underlying issue. And it's usually uncovered when the parents obtain a comprehensive assessment that includes a psychological or a neuropsychological assessment. And then sometimes the underlying issues become diagnosable.
Mhm. And some of the factors which you will see, or do you see that places somebody at a high risk of these substance abuse? Do you have any tips for that?
Well, no child is completely protected. There
Mhm.
are protective environments, but no child is completely protected. And that brings us to the issue that parents need to be more aware of adolescent substance abuse. Parents need to be aware of what the warning signs are. They
Mhm.
need to know what assessments to get done if needed. They need to know what their treatment options are if needed. And that's basically why I put together this resource for them, this book.
Okay, very nice. So tell us a little bit about some of the factors which somebody should be looking out for in their teenage, daughter or son,
Yeah.
when that kind of points there could be a problem starting.
Yeah, that's a very good question. And in my book, I have warning signs for alcohol. I have warning signs for marijuana. I have warning signs for a child that might be developing an eating disorder. I
Okay.
have warning signs for a child that might be developing a self injury, because many times an eating disorder and self injury will accompany substance abuse.
Hmm.
But as a general rule, what I recommend to parents is pay attention to the changes you see in your child.
Hmm.
Don't assume that the changes are just normal adolescent acting out. They may very well be, but they may also be a signal that something else is going on underneath the surface. So pay attention to the changes that you see in your child. For example, you might have a child who was making very good grades and now the grades start to decline. You might have a child that was very outgoing and social and now becomes more isolating and more quiet. You may have a child who used to participate in sports no longer wants to participate in sports. You may have a child who introduced you to their friends and now becomes very secretive about who their friends are. And the more of these changes that you see, the more concerning the problem is.
And do you think also some of the other factors could be impulsiveness and also this high sensing seeking behavior, like they really need a lot of emotions or perceived low harmful things they're using, that like you're saying vaping.
Yes, yes, that impulsiveness, that thrill-seeking behavior. Sometimes it's peer influences, who your kids are hanging out with, that help they get introduced to the substances. So there is no one size fits all.
Mhm.
Every child is different. Every circumstance is different.
Mhm.
So it could be a multitude of factors that all come together that make a child more likely to experiment with a substance.
Okay, and so tell us a little bit about, where we always see a little bit difficulty usually with teenagers is, you ask them few questions and their answer is always very, very brief
Yeah.
and they don't like to be engaged. So how should somebody start conversation?
Well, what I recommend to parents, and actually this is a skill that we can all learn,
Mhm.
is to practice good communication skills. Dr. Moby, we're very good at listening to people's words. We're not so good at listening to the feelings underneath those words. And that's a skill that we can all learn and every parent can learn.
Mhm.
And I recommend parents that they practice that skill so that when they are talking to their child, they're not just hearing their child's words, they're hearing the feelings behind those words. And that's a process that may take some time, but it's a skill as a parent that you can use whether your child is 9, 10, 11, or 17 or 18 years old. And it is a skill that will pay dividends in the long run.
And of course, that will come from time, but main thing is first have some kind of communication, some kind of friendship, lines open, so they don't feel intimidated or they don't feel scared of telling. So there should be some kind of comfort level between parents and kids, right? Because if some parents tend to discipline them a lot, so then they're not going to say anything, which might say they might be doing, but they're afraid of even telling a little bit.
That's right, and you want to develop that trust factor with your child, which
Mhm.
takes time. We there have been surveys done that ask kids, what is it that keeps you from talking to your parents about things that are bothering you or things that you're doing?
Mhm.
And the number one response that comes back from kids is a fear of being judged. They have a fear of being judged by their parents, and that sometimes will keep them from perhaps talking about things that are on their mind.
Oh, yeah, and they might think, they might call me stupid or this
Yeah.
question is goofy, right?
Yeah.
So, but no question is stupid actually. So nothing is stupid. It is, and many times, they. Other thing always see that they don't know where they are on crossroads. They don't know where to go. There's so much information. Their mind is still kind of trying all different avenues. They don't know if they are good enough for that. And second is if they can be successful and what to do, and that sometimes leads to depression, loss of self-confidence.
Yeah.
And how do you think we should help them with some of those talks?
Well, I think to be encouraging, to have a
Okay.
positive outlook, to be able to talk to your child when perhaps they've experienced a failure, or
Mhm.
perhaps haven't done as well as they think they should be doing, and
Mhm.
to always use a more positive approach, a more encouraging approach, to help that child see that there is a chance that things can get better, and that
Mhm.
you believe in them as a parent.
And that is very important, that to keep recommending and keep encouraging their any behavior or thought process, because interest, other thing is which some of the behaviors which I see is before that was before COVID was also there, but now with COVID is also worse. And why is that? This population, especially teenagers, is getting really worse with COVID. um,
You bring up a very excellent point, because I think we're just beginning to scratch the surface on the mental health needs for both adults and kids as a
mhm,
result of this COVID. The Centers for Disease Control has already noted that there has been a large increase, an over 20% increase in the number of emergency room visits by grade school children during the COVID. And there's been over a 30% increase for teenagers who are urgently in need of some type of mental health care. And I think what we're going to see is a tremendous need for mental health services for both adults and adolescents as we move past this COVID, and kids start to reintegrate back into the traditional academic classroom.
mhm. And that is really important now with COVID. Of course, things have gotten really worse. Other thing is because they are not going out at all. Yeah, and that's interesting. Is I've seen in the past they were on the monitors and computers all day long, not going out. Now with COVID, they some of them really hate computers and Zoom and all. They hate all that. They want to go out, but now we can send.
They do, and they've been disconnected from their social environment. They've been disconnected from from their friends, from their social activities, in many cases from their sports activities, and just the regular classroom school environment that has been away from them for a year.
Mhm. Also, I like to also emphasize a little bit about some of the sleep issues, which I've been also seeing that they're having a lot of issues in terms of either they're sleeping a lot, sleeping 12 hours, 14 hours, and more, and then also, or some are really up all night and just trying to do things. So, do you see also that tends to lead to more worsening of their mental health?
Yes, yes. I think there are cases of depression. There are cases of sleep disorders. I think there are excessive amounts of gaming going on,
Yeah,
far more so than was around in 2019. You know, the amount of time that kids are playing on their video gaming and other gaming devices is about 500% more than what it was in 2019. So definitely, this is having all kinds of an effects on kids, and some of it is leading towards more compulsive behaviors as
yeah.
well.
Okay. So I also want to touch a little bit on video gaming. So tell me a little bit how to approach and what is would be considered normal versus abnormal behavior in video games.
Well, I think when you start to see gaming activities interfere with other activities, when it
Mhm.
becomes consuming, so that a child is spending large amounts of time during the day and at night on the gaming console, when it's starting to interfere with other activities that the family might be doing, when it's interrupting a normal and healthy sleep pattern, when it almost becomes an obsessive type of behavior, then it becomes a problem. And the difficulty that many parents have is trying to intervene and to reduce that time and set limits, which is what parents need to do.
So best approach is to kind of set a little bit limits on that and tell them that do not cross that, you still can play video games, but limit the time, right?
Exactly. Limit the time to what's reasonable given the age of the child. You know, you might have a different limit for a child that's 8 or 9 as opposed to a child that might be 16 or 17.
Is there any correlation of video games or with other behaviors?
Not that I'm aware of, not any direct correlation, although I think in some types it does indicate some type of compulsive personality going on. So it may very well come across in other areas, you know.
So, also, I would like to ask you about role of diet. So we are seeing a lot of actually with COVID, more problem with people gaining weight, of course. So also, is that playing a lot to some of the mental health issues?
I think diet is an extremely important issue. Nutrition, diet, weight management, exercise, all of these contribute to mental health, to the mental health. And during the pandemic, I think we probably are beginning to see some adolescents whose weight has been increasing. Their exercise is not what it used to be. So definitely good nutrition, exercise, daily sleep on a good sleep pattern. These are all important to to solid mental health.
Okay. Also, I'd like to ask you a little bit about again about the addiction. So let's say a parent already is suspicious of there something problem in terms of addiction.
Yeah.
So first of all, how should they approach that to their kid, and
Well,
what should they say?
the first thing to do is have a conversation with your child and see what their response is, to see what information they're willing to share. That's a conversation that's very likely to go one of two ways. It's either going to blow up and the child's going to become defensive and argumentative and deny everything, or it may go the other way and you may learn some things about what's going on with your child. But regardless of which way it goes, my book has a chapter on it that talks about the assessments that you need to get done as a parent. So
Mhm.
when you suspect your child is using a substance, you need to have the conversation with your child, and then you need to proceed to getting these assessments done so that you can get a comprehensive assessment, you can get a diagnosis, and you can get a treatment plan in place if it's needed.
Okay. So should that conversation be with both parents there, or should be one to one?
I think it depends on the situation in the family. If you have a child who has a better relationship with one parent than the other, then perhaps that parent should take the lead.
Mm. So, okay, so, and maybe then as some of the direct concerns, should they just first ask casually or should they just be more firm in their approach, or they just want to know and then kind of take to the counselor?
Yeah, I think the discussion that the parent has with the child is based on concern. It's
Hmm.
based on observation. I'm seeing these behaviors, and I'm curious as to what is behind them.
Hmm.
Not in you don't want to accuse your child of anything. You don't want to threaten them, but you want to approach it from a standpoint of being curious. I'm seeing these behaviors. I'm concerned. I'd like to know more about what's going on.
Hmm.
And then, regardless of the response of your child, you need to move to the next stage, which is to get these assessments done.
Mm. And also, many times parents can see the denial, total denial, and because they are not professional. So, either way. So remember to make sure if you have problem, just or you think is something underlying, then may seek a counselor. Professionals, because the kids could outsmart their parents very easily. And then next thing is that they could just give answers what they know of their parents, that they say, okay, no, no, this isn't it, this, but they keep on doing underlying. And I think that's another thing which I see some of these teenagers, unfortunately. I have known some of the families where they committed suicide, and
Yeah.
then because I think they gave answers to their parents, which were they knew the parents would just keep lip tight or just not bother them. Yeah.
And I think many times parents want to believe the best of their child,
Yeah.
and this issue of drug abuse is a frightening issue for many parents. I've assessed a large number of teenage boys and girls for
Mm.
alcohol and drug use, and when I've sat down with their parents and I've gone over the history of their child's drug abuse, many times they would look at me and they would say, I had no idea this was going on. Or if they did suspect their child was using a substance, they would look at me and they would say, I knew this was going on, but I didn't know it was this bad. So unfortunately, many parents are reluctant to address this issue, sometimes out of fear, sometimes out of trusting their children. Um, but many times it's because these parents just were not aware of the warning signs that they should be looking for.
And or they might be even in some kind of denial too. It is very painful for them to even kind of go to the depth of it,
Yes.
because I don't think, and I see that, as we age, and then, for us to see our teenagers, son or daughter doing things which we don't like. I mean, I think our behavior is also like has changed, and for we are our tolerance is also kind of not as much as to even we are more vulnerable to even hear that that our kids are doing this dangerous behavior you know
Yeah, that's true.
so, but I think that's where I think important role of counseling and then professionals come, because you see those patients and you actually, for you, A, B, C, whoever is that, for you, they are a patient and you kind of go to their depths and you do your comprehensive assessment. You don't have that biological connection that, that can sometimes cause us to close our eyes earlier, right?
Yes, that's very true. We tend to look at it through a different lens than what the parent looks at it, which oftentimes leads to a completely different conclusion.
And I think, for every parent, it's very painful to even acknowledge or even realize for a moment that their kids are failure in some way. Yeah.
It is very painful and it's very frightening for parents to come to that realization. And many times the parents need support and help as well. And I wrote a parent workbook that accompanies my main book just because of that reason, because I recognize that parents, they need support, they need help, and they need somebody that they can have there that's for them as they go through this journey of dealing with a child who is abusing alcohol or is abusing drugs. The parents need support as well.
Mhm. And I think the good news is for everyone is to, if you get this, if you are suspicious, you have all kind of help around you. Just don't be shy. Just take the bold step and seek the help from the professionals, and that is the best you can do. And still, of course, family support. I always say to all my patients too, no matter what your kids do, good or bad, you're still their parent. And he or she is still your kid. They can disappoint or make you proud, but at the end they are still your kid, right?
That's absolutely right, and there is hope. There is hope
Yeah.
for recovery. There is hope that your child can get through this, that they can come out and survive this and go on and lead a fruitful life and a successful life. It may not seem that at the point when you're dealing with the crisis, but there are good treatment programs out there. There are good treatment providers out there, and your child can get through this, and you can get through it too.
Yeah, and so the basic thing is make sure don't lose hope and also keep working, with a counselor and yourself with full support. So just remember, no matter what, he or she is still your child. Do not depend on them. Do not break your ties, because that is the hardest thing they will have. You know.
Yes, absolutely. You need to hang in there. You need to get help for your child. You need to get help for yourself. And you need to remember that there is hope. There are successful treatment programs out there. There are very good counselors and therapists out there, and they can make a tremendous difference in the life of your child.
And also just make sure that if you're not successful with one, doesn't mean that you'll not be successful with another. So keep knocking on door, but keep working on it, and you'll definitely reach a better point than this. So with that, any final thoughts you would have for our audience?
No, I just recommend that if you are a parent or you are a family member and you are interested in knowing more about adolescent substance abuse, about the warning signs, about the assessment, about the treatment options, that you get a copy of my book,
Mhm.
the Addicted Child: A Parent's Guide to Adolescent Substance Abuse.
Mhm.
It's available on Amazon. It's available through the book's website, which is www.helptheaddictedchild.com. If you like to read on a Kindle, it's available for 99 cents. If you prefer the paperback, you can order that too. But I would just encourage everybody out there who is interested in this issue to get a copy of the book and learn about adolescent substance abuse, the warning signs, the treatment options, and just be better prepared to deal with this issue if you have to.
Okay. Well, with that, I would just encourage everybody to make sure be more vigilant and don't lose hope, and keep working with counselor, with all of us. And the more knowledge you have and more actually help, then you can help your kids as well as help yourself. It is very important that we all educate each other. So with that, thank you for watching our show. Thank you, sir, for great talk, and it's such an important talk. And I would again congratulate you on writing such an important topic. And I can only count few writers and also maybe a few people who are really helping teenagers to solve this crisis. I would say crisis, and it's such an important topic. I wish we had more people like you. Thank you for coming to our show. Thank you.
Thank you, Dr. Moby. I really appreciate you taking the time to talk to me about this issue. Thank you so much.
Thank you.